Hey everybody, my name is Dr.Asad. I'm a neurologist and a brain injury specialist, and we are talking about concussions, commemorating the Concussion Awareness Day. I'm here at the Universal Neurological Care. So today we're going to be talking about a few myths surrounding concussions, and we want to set the facts straight. So one of the myths surrounding concussions is that you have to have direct injury or blunt trauma to the head in order to have a mild traumatic brain injury or a concussion. That is not necessarily true. So for example, let's say you're playing soccer, running down the field, trip, fall, hit your shoulder maybe, but the rotation of your head causes jostling, jolting of the brain inside the skull and leads to a misfiring of the neurons or the cells of the brain. That can result in a concussion without direct injury to the brain. Important to consider. Here's one misconception about concussions, that you have to lose consciousness in order to have a concussion. The truth of the matter is, only 10% of individuals who have a concussion lose consciousness. So, if there is a suspected mild brain injury and someone has headaches and dizziness, unsteadiness, didn't necessarily lose consciousness, concussion would still be in the realm of possibilities and should be considered. One of the myths surrounding concussions is that when the brain is exposed to impulsive forces, that you have to have symptoms right away. And if you don't have symptoms right away, it's not a concussion. Again, not true. You can have symptoms that occur sometimes days or even weeks after the impact. And the symptoms to look out for in those situations are headaches, balance issues, vision problems, ringing in the ears, cognitive issues, mental slowing, mood issues, irritability, etc. One misconception about concussions is that when someone has had a concussion, you have to keep them awake. So that myth arises from the fact that if someone has had a brain bleed and they're asleep, you might miss the clinical symptoms of a brain bleed. In reality, the chances of a brain bleed with a concussion are very, very low. And in fact, it's beneficial for someone with a concussion to get plenty of rest, plenty of sleep, so that the brain can rejuvenate from the injury. Okay, so one of the myths surrounding concussions is that you can return to play immediately after a concussion. Like we mentioned earlier, because sometimes the symptoms don't come about for a few days or even longer, if there is a suspected concussion, it's a good idea to wait and see how the individual does before returning them to play. There are graduated return to play programs and protocols, and it's a good idea to go through those programs to make sure you don't risk another injury, which could be devastating while the brain is trying to heal from the first. So one of the misconceptions about concussions is that once you've had a concussion or once you're diagnosed with a concussion, you should stop all activities. Don't play, don't learn, don't go back to work, don't watch TV. And while sensible rest for 2 to 5 days after a concussion makes a lot of sense to allow the brain to rest and rejuvenate, putting someone in cocoon therapy where they're not allowed to do anything until all the symptoms resolve is counterproductive. And so in this day and age, while we do recommend sensible rest in the first few days, after that we recommend a rehabilitation program to take care of the persisting symptoms that someone may have and returning them to all usual activities, be it learning, be it playing, or be it work. So one misconception about concussions is that it only occurs in athletics or sports. And while sports-related concussions are an important field, the most common cause of concussions is actually falls. And the second most common cause of concussions is motor vehicle collisions. So we're all potentially at risk for mild traumatic brain injuries and even moderate and severe traumatic brain injuries. So important for us to understand the implications of brain injury and what to do about it if we find ourselves or our loved ones in this situation. There's some confusion out there about how long it takes for individuals to recover from concussions. The vast majority of individuals will recover in the first 3 to 4 weeks of a concussion. So we're talking about 80 to 85% of individuals. For people who are in that category, support, sensible rest, gradual return to normal activities, making sure you're managing your sleep and your headaches with over-the-counter anti-inflammatories, sleep aids like melatonin, etc., will help aid in that recovery. There are individuals who will have longer courses, and the longer it goes on for, the harder it is to treat. So if you are beyond 1 month after a concussion and still are having symptoms, really important to seek medical help and undergo the rehabilitation and the treatment to prevent chronification or long-term issues. So one of the myths surrounding concussions is that helmets can prevent concussions. Helmets were designed to prevent skull fracture, and they do a really good job with preventing skull fractures. As far as concussions are concerned, we're talking about the brain jostling and jolting inside the skull, and helmets might mitigate the risk, but they will not ever be able to prevent concussions. So that's important to know. So one misconception about concussions is that everybody with a concussion gets better. While it's true that a lot of people do, some people do not. And it's really important to understand the signs, the symptoms, and the possibility of chronification or long-term issues, and seek the appropriate help in those scenarios. Also, if someone has had recurrent concussions, those can be cumulative. So your brain can bounce back maybe once, maybe twice, but you definitely don't want to push your luck with recurrent concussions, as we've all seen with football players who've ended up with neurodegenerative conditions like chronic traumatic encephalopathy. When someone is concerned about a concussion, a lot of times they'll be interested in getting an imaging study of the brain to see if they've had a concussion. Prior to now, a CT scan or an MRI did not show a concussion. This is happening at a cellular level, at a neurotransmitter level. That's below the threshold of imaging. There are some new imaging modalities, diffusion tractography, susceptibility-weighted sequences, that show injury to the brain in a small percentage of mild traumatic brain injuries, according to some studies up to 27%. So you can still have a concussion even if your tractography study is normal. However, if the tractography study shows findings of brain injury, that might corroborate your clinical diagnosis. Remember, there's not one specific test that shows concussions. We use functional testing like video nystagmograms and oculometric testing to look at eye movements and posturography studies to look at balance. These are not specific tests for concussion. However, they help corroborate the symptoms and, more importantly, give us targets for treatment so that we can help the individual with rehabilitation. So finally, the best way to manage concussions is to get educated. Understand the signs, the symptoms, the resources available to manage concussions if you're ever in that situation. If you are at high risk, for example, let's say you play certain contact or combat sports, it's a good idea to get baseline testing. Nowadays, there's a lot of technologies available to evaluate your brain structurally and functionally pre-injury, so that if an injury occurs, your physician can use this data to determine if there's been a change. And finally, thank you so much for listening, and we hope that you found this video beneficial. Have a good one.